evidence-based birth kind of like podcasts and their research, they did this whole series on like protecting your perineum, which is really,
oh yes, I did.
Really informative. I think it was 4 or 5 different podcasts on just the evidence out there as far as determinants in leaving a birth with an intact perineum. And the like number one determinant that they had kind of talked about was who you choose as your provider, which I think is very interesting as well. You know, definitely choosing a provider that has low episiotomy rates for sure was a big thing. But also just having that, being able to have that trusted relationship with whomever you choose to be present at your birth, having a collaborative kind of approach. So choosing a provider that might be open to hearing kind of your ideas. And I have a friend of mine, well, she's a new friend of mine, I just met her, but she's 6 months pregnant with her first, and we were just, you know, talking about everything. I'm like, oh, I'm a pelvic floor therapist. So she's like, oh my gosh, I have so many questions. We were talking, and she's like, I feel like I'm flagged in the system as like, oh, this girl is like difficult or whatever, because she, you know, is really adamant about like doing the research, like getting as much information as she can beforehand and asking all the questions. So she's like, yeah, they probably hate when I come in because I'm that person. But I'm like, no, but that's how it should be. And if your provider is annoyed by that, then maybe that's, you know, right. Maybe that's not the best provider for you. Like, I love it when our clients come in and ask questions, and we get to have those conversations, and they've done research themselves, and we can have those, you know, conversations and come to those decisions together to make it that collaborative approach. And like, I wish and I hope that that's, you know, the experience that, you know, we can kind of eventually get to with that. So hello.
Here he is. He should be good. He joins me for webinars quite often. So
I love his presence.
I agree with you 100%. And I think it's a huge red flag when a provider is not responsive to questions that somebody asks. I feel like people in the hospitals in the area probably know when somebody has come to my birth class, because I'm like, okay, here are questions to ask. Here's how to ask these questions. You should be asking questions at every visit, because if your provider is not willing to take the time to answer questions you have about childbirth, which is this huge experience that you're just about to go through, then that is a huge red flag. Either time to find a new provider, time to arm yourself with advocacy skills, time to figure out more about your place of birth and figure out how that fits into your list of priorities or preferences. Because it's so true that the person or the people you choose to support you in birth are a huge factor in terms of how you're going to feel about your birth afterwards. I would even say not necessarily the things that will happen during the birth, although it's possible. But I think when somebody is willing to be an advocate and has the confidence to speak up, then they can have a positive birth wherever they're giving birth. Right. But the issue is that did you move through that birth experience feeling like you had to fight every step of the way? Or did you move through it feeling like you were really well supported by your clinical providers? And I think feeling like you were really well supported can impact the way you look back on your birth so much differently than feeling like, yeah, I had the birth that I wanted, but I had to fight tooth and nail for it every step of the way. So yeah, I think it's huge to make a really good decision about who you are choosing for care. And you know what's so interesting that I hear about so often? I have people say, well, I asked my provider all these questions and they told me, we'll talk about that when it's closer to labor. What? Like, no way. This is so great that at 20 weeks of pregnancy, you're asking about things like upright birthing positions. Why is that being blown off? Because by the time that question gets answered down the road, if you don't like the answer, it's going to be a little bit challenging to find a new provider late in the game. The provider.
Questions. Yeah. I mean, we hear that too, of like, well, how come no one told us to come to see me? Like, why was it my sister and my sister-in-law and all these, and my mother? Like, we have some moms who are like in their 60s and 70s who have told their daughters to come see us, which is pretty cool.
That's amazing.
Yeah. But what are some questions that people should arm themselves with to help with their birth, that ultimately helps them throughout their whole pregnancy and their birth and postpartum?
Yeah, so I can give you some specifics, but I think what's even more important is understanding how to ask the questions. I always tell people, don't ask yes or no questions. Don't say to your provider, are you comfortable with me being in all fours when I give birth? It's way too easy to be like, yeah, sure. Like instead, how often are you catching babies when somebody's in all fours when they give birth? And if the provider's like, oh, sometimes, when was the last time you caught a baby in an all fours position? Like asking these questions that are not just a yes or no response. I also tell people be really attentive to how a provider answers the question. If they give you an always or never answer, that's just not good because there's not in childbirth, there's never an always or never. Well, here I said that, never. It's not a situation where you can be like, I never cut an episiotomy. Well, that's not safe because sometimes an episiotomy is necessary.
Right.
Or, we are always okay with people being in any position. Really? Because if there's a concern about the baby's heart rate, are you still going to be okay with me doing whatever I want? It's the always and never responses are also red flags in my mind. So in terms of the questions somebody should ask when they are either interviewing a provider or getting to know more about their provider's practice, I always tell people ask open-ended questions. And it's really helpful if they go into it knowing at least to an extent what their priorities might be. Like, for example, if somebody is like, I want to get an epidural, but I also don't want to get it like really early on. I want to experience some of labor. So if they're in a situation like that, they might say to their provider, if I want an epidural in labor, but I don't want it yet, how are you going to support me in that decision-making process? And that, I feel like that question to a provider is gonna be like, well, we're not. You're just gonna get one. But that's like, okay, you're not like that. Okay, now I know. Now I know I need to maybe get a doula. Maybe my support person needs to really understand how to help me with comfort until I'm ready to get an epidural. Like making sure that even regardless of what someone's preferences are, that they're asking questions in relation to their preferences and asking open-ended questions and being on guard for always or never responses. That's how I would kind of frame communication with the provider prenatally. In the moment, in labor, when somebody does have strong preferences about something or even just preferences in general, I think it's always helpful to not wait till you're in the moment to say that. But instead, like preemptively, like you're in active labor, let's talk about what you might want to do before you're ready to push, or you have certain preferences for immediately after birth. Let's talk about those when you're starting to push the baby out, as opposed to like waiting until the baby's out. And a lot of that falls on having a support person who's a great advocate, whether that's a partner or a friend or a doula or a combination of those. Having somebody that can do all that thinking and help you with that advocacy so that in the process you don't have to use that thinking brain, that's really important too. Oftentimes I feel like people think, well, I don't really, I don't need a birth class because I'm going to get an epidural, or I don't need a birth class because I'm going to be induced. You still need a birth class because a good birth class is going to be far more about developing communication skills, building confidence for birth, helping you figure out what is important to you. Even if there are things that are totally not important to somebody else, there is still going to be something that's important to you in your birth. In my opinion, a good birth class shouldn't teach someone how to give birth, but instead really help them develop skills to have a positive and empowering experience, which is something that everyone deserves no matter how they're birthing. Cesarean birth, vaginal birth, induction, spontaneous labor, epidural, no epidural, home birth, hospital, birth center, doesn't matter. Everyone deserves to come out of it feeling like, wow, I totally did something awesome, as opposed to being like, oh, that terrible situation happened to me.
Yeah. And I think that what you said of like how to ask the questions is exactly why we like started this platform, because that is one of the biggest things we hear from people, whether they're going through their fertility journey, whether they're going through pelvic pain journey, which it takes an average of 3 to 5 to almost, I would say more like 8 years to get an actual diagnosis and specific treatment for things. So being able to ask those open-ended questions, I think is so right on. Yeah. Like, even if you're listening and it's like, oh, I'm 55 and I'm not having children anymore, like this is a huge thing for all of us to just listen to and to really start to take confidence in. So
life skills. It's life skills.
So true. So true.
It is. It's really true.
I was laughing at the always or never because I feel like it's an inside joke. I feel like within the PT world of like you ask a PT a question and they're going to say, well, it depends. And,
that's
A, B, and C. It's always it depends. And I'm like, no, that shouldn't be a bad thing. Like you want to know, like, it's all of the different, kind of sides and what's out there. Yeah. And it depends on the person that you have in front of you and the exact situation that you're in. So I was kind of chuckling at that in my head a little bit.
I didn't even think of that, but you're right. We always say it depends. It's never a yes and a no.
Yeah. And it's so true. We have that same joke in the doula world because when you ask a doula, like, what should I do? They're not going to be like, you should do this. They're going to be like, well, here are your options. And here's what would happen in each of those individual scenarios. And here's what the research says. And what does your provider say? And now, okay, take all this information and make a decision that you feel good about. And that's how, I feel like that's how it should be. Yeah, it's a lot more work for the person, let's say the person giving birth, than just like going with every single thing that's recommended. But sometimes the things that we have to work a lot harder for are the things that are more rewarding. And again, it's not about a certain way of giving birth. It's about coming out of that experience feeling like really awesome about it.
I agree.
Yeah, totally.
Yeah. And I don't think there's like one way that's like better or the other. That's another thing that I was kind of, the more and more that I've gotten into like, all of the evidence and just knowledge on like birthing, because as a pelvic floor PT, we don't get a lot of, obviously we learn about the pelvic floor and the anatomy and all of that in regards to pregnancy, but the actual birth process, we don't go through
what stage 1,
so
negative position 1, 0, like no.
Here people are coming to me with these questions, and so I'm like, I'm trying to read and do as much as I can. And I think as I've like been learning more and more, it's like there's advantages, disadvantages, like you could go on and on about pros and cons to this, to that, but at the end of the day, it's what's working best for the person, for the individual birthing person, what they feel most comfortable with. There's no like, this is the best. And so I think sometimes that scares people when they're told that. And they're left to kind of like make their own decision, because I think there's the fear of like, well, the what ifs, or did I make the right decision? But I think that's where you were talking about like whoever you have in your birth with you, whether it be your doula, your partner, a friend, your mom, whomever is there to kind of support you so that you don't have to feel like the weight of all of the decisions fall on you. There is someone that's kind of, supporting you through that. So
and that's when, we have the referrals for mental health counseling of like, are there confidence issues and shame issues we need to work through to be able to use those beautiful cues that you were sharing with us to kind of feel more confident of like, I'm going to ask an open-ended question and I'm going to use my voice because my perineum requires me to. So it's such a cool thing.
That's the best thing ever. I'm going to use my voice because my perineum requires me to.
That's an Instagram post. Write it down.
That's so good. That's so good. I love it.
These are the things we say during lunch, and we're like, oh yeah, that should be something.
That's awesome. That's awesome. And one thing in the moment too is that you guys were talking about how there's not a whole lot of training in actual birth as a pelvic floor PT. And one thing that I've noticed with talking with pelvic floor PTs in general is that there's not necessarily, thank you. There's not necessarily an understanding of what providers are used to doing in the moment. Just because, which is of course understandable, because if you're not attending birth, seeing it, how would you know like what actual like real life situations are looking like? But one of the things that's so interesting is that although we have this research that says spontaneous pushing is ideal, exhaling as you bear down is ideal, protects the pelvic floor. In the moment, providers are often like, okay, chin to your chest, push down, bear down, don't let that air out. And in a situation like that, I talk a lot with my clients in advance about how that might not be the most ideal way to push a baby out. And it's funny because sometimes they're like in the moment, how are you going to dedicate the energy to tell your provider, no, I'm not going to do that, when you're like, literally your body is just like, we got to get this baby out. And I always tell people like, say my pelvic floor PT told me not to do that. And then a provider's like, Okay, because now it's like, oh, all right, they're seeing a specialist for their pelvic floor. Okay. Whereas if it's like, my doula told me not to do that, providers are like, oh, doulas are very low in the hierarchy. So even though we might have a good knowledge of the research, we still are low in the birth hierarchy. But when a provider sees that you're seeing someone else that is a doctor for clinical care, I think that carries a lot of weight with it too. So so one of the things that I often say to people in birth class or my doula clients is, if you know, like, you want to be pushing your baby out a certain way, or this is what feels good to you, you can always say, this is what my pelvic floor PT told me to do. I'm protecting my pelvic floor. My PT told me to do this. And I think that carries some weight to it. So I don't know if that really has anything to do with what you were talking about, but what you were saying brought that up to me.
Yeah. I think too, you could honestly tell clients to tell their OBGYNs, well, you didn't learn about my pelvic musculature. I know you can only explain the origin and insertion, but you have no idea how to palpate it. Like, and that's true story. Like in OBGYN clinical residency and fellowship and stuff, they know the origin of this muscle is this bone and the insertion is this bone, but they do not learn how to place one finger inside, and this first knuckle is this layer of tissue, and it's specifically this muscle, and you'll feel it tense like this, and the tone will feel like that. They don't learn any of that. And we even had our first speaker, who is a pelvic pain specialist. She's a gynecologist and has a fellowship in pelvic pain. She even said that curriculum is lacking in how to truly assess the pelvic musculature. And as physical therapists, we know how to assess musculature from like day one. You start weirdly palpating your lab partners who you like just met, who you will live with for the next 3 years, probably half naked usually. But it's a really interesting kind of thing. So thanks for giving us that recognition, Britt.
Yeah. Well, I think it's nice when you get clients who come in and when they're talking to their OBGYN, they actually recognize, I'm not the expert on this subject. You should see a pelvic floor therapist. So I think there are definitely OBGYNs out there who are maybe don't necessarily know much about the pelvic floor, but at least they know that, and they're recognize their own strengths.
That's the quality of a great provider.
Yeah, when they say, I don't know the answer to that, but this is someone who will, and I will refer you to them.
We love those providers.
Yeah.
Yeah.
And I think that it is happening more often. Again, so I've been doing this work for about 15 years, and in the past, maybe like 5 years or so, I've noticed that providers are far more willing to be like, okay, this is not part of my scope, and here's the resource that you need to go to. Unfortunately, I think that a lot of times it's when there's an issue rather than preventatively saying like, okay, now, you're 6 weeks postpartum, everything's looking good. Now go see a pelvic floor PT. Instead, it's like, again, like I said, 3-6 months later and somebody's peeing themselves and they're like, oh, now you should go see a pelvic floor PT. But I think, at least that is maybe a resource that providers weren't thinking about 10 years ago that is now becoming a little bit more prevalent. But whether it's OBs or midwives, oftentimes I work with a lot of clients who work with hospital-based midwives, and midwives aren't necessarily offering up pelvic floor PT resources for preventative care either. So it's really frustrating because I think, again, it's like all about that collaborative care. If you need to have a cesarean, an OB is absolutely the person that you want to do that. If you want to have a physiological birth, a midwife is a great fit for that most of the time. But it's interesting to me that like we don't necessarily, as an OB or as a midwife, they don't necessarily see the complementary providers that could really like enhance the experience for their clients. It's just like childbirth is just very disjointed in our culture.
The whole healthcare community is disjointed in our conventional system. And that probably could be a whole nother discussion at some point with like maybe multiple providers. That would kind of be cool. But I totally agree with you that even in the past, 10-ish years that I've been doing this, primarily my first clients were somebody who was 55 to 65, who had a prolapse, who either had a surgical intervention to support their prolapse, or they did not require a surgical intervention and they had the stress incontinence with coughing, laughing, sneezing, or it was clients with significant pelvic pain starting at age 18 and then ranging all the way up to age 80. And that was really like the meat and potatoes of who I originally saw. But it is so cool now to see that women are, you know, we have to thank the mom Facebook groups and like people like you who are on social media sharing, okay, what you should be thinking about and how you can continue to move forward and find those resources. So
yeah.
It's been a big
In my classes, I've noticed in the past few years that when we talk about pelvic floor BT, which we talk about very briefly, but just when we're talking about like community resources, in the past few years, there's almost always at least one person, if not more, that's like, yeah, I'm seeing a pelvic floor PT. And I'm like, that's so exciting. And again, 10 years ago, I didn't have people talking about that. And what's so cool now is that in a group of like, let's say we have 10 couples in a class, when one person's like, I'm seeing a pelvic floor PT, and then we're talking about how great pelvic floor PTs are as a complement to all the care that you're getting in pregnancy, somebody inevitably is like, can you give me the name of your pelvic floor PT? I'm like, yes, it's so good because people, I think, again, because providers aren't always the ones giving people those resources, but when they're in a group setting with other people in pregnancy, they start to share those resources. And that's one of the great benefits of a prenatal birth class or even like a pregnancy support group, which aren't as easy to find, but that sharing of resources that happens in pregnancy is so important because people get, you know, I'm going to say people get thrown into pregnancy, not really, but they go into pregnancy and they go into childbirth without very much knowledge or preparation. Like they might have had like a ninth grade health class video about birth, and that's like it. So then when they're in a room of people,
right. You might be scarred from what you saw
because you're full of life. I remember that movie. I'm like,
it's like a birth control video. But it's like when they come into this space where they're meeting with people that are going through similar experience, there's like, it's almost as if like their safety net comes down, and it's like, oh, I can be a little bit more vulnerable. I can talk about my vulva. I can talk about my perineum. It's quote unquote acceptable in this space. And then they start sharing these more like what we might think of as more intimate resources. And I think that's just such an amazing part of like a group setting in pregnancy, because we don't really have spaces in our culture to talk about reproductive health in a safe space where there's not like, again, like just to use words that we brought up before, like a sense of shame or guilt or like needing to be shy about it. So anyway, I think that sharing of resources is awesome. So sometimes when we just like bring up one resource, then the ball gets rolling and people start sharing, and that's really cool.
That's neat to see.
And as much as social media can be a downfall in our society, I will say we've had a lot of clients that have come in and be like, yeah, I heard about pelvic floor PT from TikTok or from Instagram. And so I went on Google and that's how I found you guys. So
pretty cool, because that's another shift of referral sources for our business at this time. So
at least it's helping to get the word out there between like the Facebook groups, the social media stuff. But again, I think just advocating, spreading the word. I told him, I was like, every time I like go somewhere and I meet people and I tell them I'm a pelvic floor therapist, I instantly become the most popular person at the party. So I'm like, people want to know more. They're curious. They want to know more. I think sometimes people, are just afraid or are anxious and just don't know what resources are out there, how to ask the right questions. So I think it's, a huge skill to be able to advocate and know how to ask the questions to get the resources. So
absolutely.
Well, thank you. This was such a great conversation. I feel like we should maybe expand the topic to more than just perineal massage.
I love to talk about anything birth related, so anytime, just let me know.
We'd love to listen to you talk about it. So for our listeners, if they are interested in taking a birth class with you or just, kind of learning more from you, how can they best kind of reach out to you or find you and all the resources that you offer? Because I know you have a lot of amazing resources.
Thank you. So my website is blossomingbelliesbirth.com. And on the website, we have a whole bunch of free resources, including 1-hour webinars, many of which are free. Some of them are not, but many of them are, like practical pushing, for example, and birth plan 101 and things like that. So they can find everything that I offer on my website, including birth classes and registration for birth classes. Classes are virtual or in person in South Philly. But then also my Instagram and my TikTok are a good place to find like just little snippets of information and things about movement in labor or comfort in labor or support, whatever. But my Instagram, Facebook, and TikTok are all Blossoming Bellies Birth. So you can get lots of really, I think it's useful information that's also free on there. So.
I just referred someone to your Instagram yesterday.
Oh, yay! That's awesome.
Follow this person on Instagram.
Yeah.
That's so great. I try to incorporate more than just like movement-based stuff so that people get a little bit of like some familiarity with advocacy and consent and things like that too. The TikTok videos are mostly, I mean, it's videos, so it's mostly all about like movement and pelvic stuff and sometimes comfort techniques too. But Instagram's a little bit more like the content that I post is a little bit more varied, which I think is fun to like see. Things,
yeah.
so.
I've like I said, I've learned so much from just following you on Instagram and looking
awesome.
at your website. So thank you so much for speaking with us today.
Thank you for having me. This was so fun. I would do a million more times.
Yeah,
we
definitely will.
We love having you, and thank you so much for supporting the whole community.
Oh gosh, you guys too. Thank you.
Yeah. All right.